Hello class, this is Miss Evelyn, and this is the second PowerPoint presentation for microbiology, so PowerPoint number 2, continuing in Unit 7 of your textbook. So I have uploaded the PowerPoints for you, and we're going to get started on looking at Part 2 for microbiology. There, so we continue here where we left off from Part 1 on media and techniques. We'll be looking at fungi briefly, yeast, and virology on this section. Okay, so where we had left off on Part 1, introduced some basic media, and continuing here on page 246 in your textbook, are some other types, and again, paying attention to items in bold are things that I would could be test questions on an exam. In your textbook, you'll see a picture of what's called a bullseye combination plate. So there's in one plate there are a variety of chambers that carry a variety of different augers, and in the illustration of the Mueller-Hinton auger, can be used for antibiotic sensitivity testing, or AB, antibiotic sensitivity testing. And then other augers around it would also be there as specific types, enrichment type augers that different organisms may want to grow better on. Okay. You also might have dip slides or paddles, especially in the use in urinary growth, where you can actually just dip it into your urine and then incubate it. Entero tubes, so entero pertaining to your intestines. Okay, so entero tubes will again contain a series of multiple media throughout that tube, and you actually take an inoculation loop and you stab it into the media sort of gently but firmly, and then drag it back up through that same entry hole, and then you would incubate it and grow. And different enteric bacteria that you'll be introduced to next week in the content would grow in different types of the media. So look at your textbook on page 246, 247 for these kind of illustrated pictures. If you work someplace that has this kind of auger plates available, the bullseye, dip slides or paddles or entero tubes, always just make it a part of your life to always read the instructions and follow very carefully, and watch your current staff, learn from them, and then employ the knowledge that you're gaining from this from this course. So the next slide about quality control cultures. So especially if you were working in a large laboratory, you're going to have cultures that are known specimens, and periodically according to a planned layout of testing, you would always continue to check your technique, the techniques of your incubators and so forth, and do a quality control growth. Such cultures might include a Staph aureus, Enterobacteriaceae, isn't that a fun word? Enterobacteriaceae, Streptococcus, Pasteurella, or Actinobacillus. So again, various techniques, culturing time, cultures, steps, time, durations are mentioned in the text. And again, if you are utilizing, especially main laboratory, quality control cultures might be there. These are often kept at, control cultures may be kept at room temperature, but refrigeration at 4 degrees centigrade or Celsius reduces the metabolic rate of those organisms. Remember that growth pattern that was illustrated. Specimen collection. Okay, so this is really important for, if again, garbage in, garbage out, or if you do not collect properly and with good technique and routine technique, you're going to end up with bad sampling. Okay, so general methods, again, pages 248 to 251, just an aspiration. You know, you may have some kind of a liquid from the nostrils or in the oral cavity, or there could be also, of course, liquid swabbing, in a sense, from some other liquid. Even in a wound, it might swab the area to see bacteria is present. And then, of course, skin scraping, or you might scrape along the surface with an appropriate collection item. You might obtain samples. So those are methods for obtaining samples. Your aspiration, swabbing, and scraping, all in bold, might be some kind of a test question. So you want to obtain samples, lesions. You might, of course, fluids, skin pustules, and the textbook in those pages actually do illustrate some of the collection techniques involved. You always want to employ aseptic technique. That's very critical to getting your correct diagnostic and quality results. So if you are using a swab, or maybe even for an aspirate, rayon swabs are better than cotton swabs. That can be a test question. And why? Because cotton fibers tend to maybe shed sometimes in the media, and they can also hold more oxygen that might inhibit the growth of some specimens. So we really do want to look for sterile rayon swabs would be what you would want to order and obtain for your office. You might have culturette tubes. Again, read the label. If it's for an aerobic or anaerobic use, make sure you always read your labels and how to use them. And you could use a cystocentesis. So cysto, bladder, centesis, collection of the fluid. So collection of fluid directly from the bladder with a needle stick. Cystocentesis for urine, or intact skin pustules. You want to, of course, always get a complete history from your client, not just it's been there for 2 weeks, but you know, how has it progressed? Where did it start? Is it moving to other areas of the body? How are other clinical signs of the animal? So all of that, getting a really great complete history, sufficient clinical data on your SOAP, your subjective, objective assessment, and your plan. So getting enough of that sufficient data. Include then also, especially if you're sending this off to a laboratory, you want to write down not just it's been present for 2 weeks, but some of the progression that you got from the client, or from your veterinarian, or previous visits, okay? And was there already an antibiotic that was tried for the case and it's still progressing? That information a laboratory would really need to know so that they can start off at a good spot. You always want to collect aseptically. So you've gone through surgical skills, you know about how to keep and act in with aseptic technique. Test question: specimen contamination is the most common cause of diagnostic failure. One more time, specimen contamination is the most common cause of diagnostic failure. So you want to collect before you actually clean. So let's say, by what we mean on that is, if there is a wound or a pustule that you're going to get a sample from, if you rub the surface with alcohol, oops, that's supposed to be betadine. I will correct that on your copy. Betadine, or hydrogen peroxide, those kind of mild disinfectants, yeah, it's a good step to clean. Prevent the growth of the organisms. So rather, you may just want to use a little bit of light water, remove the light debris or dirt, but don't really use a disinfectant or antibacterial agent before you collect your sample. Then, of course, when you go for treatment, you're going to continue on with appropriate disinfecting, scrubs, and so forth as directed by your doctor. Also collected as soon as possible after any onset of clinical signs. But that idea of do not over clean the area. You want to remove surface dirt and hairs and things like that, but you don't want to over clean it with alcohol, hydrogen peroxide, or betadine. Also, if you're collecting multiple specimens on one patient, you have to keep those separate to avoid any cross-contamination, and definitely precise labeling. Where did you get that? Was it from the right elbow? Is this one from the right shoulder? So where were the specimens collected from? And this is definitely essential for any intestinal specimens. If the doctor was doing this surgically and they're sending something in specific locations, and of course always check with your doctor if you need to know what area of the intestine or how they want that labeled. Also avoid formalin. Okay, so if you're sending something to the laboratory and it's a bacteria, well, formalin is a kind of preservative, so it may kill it. So if you are sending in samples for histopathology that are in formalin and also a smear or a culturette tube, you want to have those in separate laboratory bags so that that formalin does not affect your other bacterial sample. And of course, label properly. Label the specimen container. Fill out the forms with complete and sufficient detail. Again, garbage in, garbage out. You give something very poor to the lab, you may not get the right results. And take adequate time on collecting your sample. If it's hasty and quick collection, will often lead to poorer results. And again, I can't stress this enough. The diagnostic lab can only give you the results in relationship to the sample presented. So poor collection, poor results. So watch your technique, be consistent, grow consistency of how you do things. Learn it also from the staff that you work with later on. There is a great table on page 249. No, I am not going to make you spit that table back on a test, but look at it, read it over, and kind of get an idea of how you would present samples. Later on in the hands-on skill part, we will probably try to have a guest lecture come in that would actually go over how to do sample preparation for a diagnostic laboratory. But just a couple ideas here. Most samples can be shipped at temperature. Now, we're talking here about bacterial samples that are going to go to the lab within 12 hours probably of collection. So, of course, if they're kept longer, you may want to refrigerate them. And whenever you have any question, contact the laboratory first and then follow the directions. Urine can be kept in the fridge until it's shipped, and then maybe ship it with cold packs. Milk samples could be frozen. And you have different types of tubes that items that could be utilized. Culturette tubes, you will see those in your hands-on lab. You might have a sterile tube, a sterile cup, sterile syringe, something that's called a whirl pack. You can look at the textbook, whirl pack. And then, of course, on caps and jars. Always establish a great systematic approach to your procedure. That will be, we'll try to have that enforced, or encourage you, I should say, encourage you during the lab sessions. Do your procedures the same way. And if in a regular practice, there might be a flow chart to just assist that everybody does the same steps. You want to choose properly the medium or the auger that you're going to utilize. Generally, a general nutrient auger will be used, or blood auger, or what's called McConkey's. Now, we are already and introduced you to those type of names in the previous PowerPoint. Generally, you want to incubate, and you want to incubate at about 37 degrees Celsius. That will be a test question. 37 degrees Celsius or centigrade is what you generally want to incubate at, unless you have a thermophil type organism that wants a higher temperature, or one that is from a reptile or something that might want a lower temperature. Also, if the sample's from the skin, you may want to incubate at a lower temperature because it's not from the internal part of the animal. So always consider where your sample, your specimen is from, what is the species, where is it located on the body, and might you want to change some of your incubation temperature because of that, or other areas of your care of your specimen. Generally, we want to incubate for 18 to 24 hours, and then we'll examine it. So if you're working in a regular practice and you get your sample at 4 o'clock in the afternoon, you'll want to look at that, probably glance at it the first thing that you come on duty at 8 the next morning. It indeed may continue growing on the initial plate for 24 hours, maybe even up to 48 hours. But generally, we look for the freshest samples that we can get, and then start trying to gram stain and look at those. And generally, gram stain is your first stain that you're going to use. Again, that might be driven by what is the organism of suspicion that you might have. And then additional tests might be utilized. And we're going to be looking at those for future in this PowerPoint about some various tests. And then there's a table on page 253 about gram stain. Look that over, and also look over Appendix B. Just kind of do a shuffling through the pages right now. We're going to reference that more so next week in the second week of microbiology, but I want you to start just looking at it and seeing how it is put together. Appendix B. So regarding blood agar, okay? And again, this is there could be some test questions on the bottom of page 256 and here in the bold. Most gram-positive, okay, purple staining organisms, most gram-positive and gram-negative organisms, the reddish-pink organisms, grow on blood agar. Most do that. Of course, not all organisms have read that statement, but most gram-positive and gram-negative will. Usually gram-positive do not grow on MAC, on the McConkey. Usually gram-positive do not grow on MAC. And most gram-negative will grow on MAC. So if you have a suspicion, you may want to do an initial inoculation on blood agar and on a McConkey simultaneously, possibly with also a general nutrient plate, and see how the organism looks. How does the colony look? Is there any growth? And on which plate does it grow? So this would be a test question. Most gram-positive and gram-negative organisms grow on blood agar. Usually gram-positives do not grow on MAC. And most gram-negative will grow on MAC. So when possible, select a colony for subculture from the blood agar. So if you were doing an initial incubation on nutrient agar and on blood agar, if you're going to subculture 24, 36 hours later, you're going to take a colony from the blood agar. Why? Because inhibited microcolonies may be present on a selective media, such as MAC. Okay, so if you're going to do a subculture or actually do your gram stain, you're going to your best choice would be from the blood agar. And again, as you are will be utilizing your skills in the laboratory setting, always plan ahead, and that little D is on purpose. In this case, plan ahead, okay? Prepare your lab space before you start working with your organisms. You want to have an area to dry your slides. I like to usually use a staining a test tube rack or something that the slides can actually lean up against and that they'll be able to dry. If you're going to get your scope out, have oil immersion near you, have a couple pieces of lens paper. Do have a pen, a note paper, or a pad. We prefer that you, or actually we will train you not to have your full pack and everything else of your belongings on top of the black tables. We want to have just the items there that you need, and it would be best maybe to be able to leave some kind of a note paper pad in your drawer that you will be assigned, and also your pens. Do you want to take those pens back home that you've been handling with your gloves that may have had organisms on them, and later on put that pen in your mouth? So we like to kind of train you to have your items for the lab and leave them there, okay? Also, prepare yourself. If you need a restroom break before you start, you know, wash your hands. Take your gloves off properly, as the PPE section in PowerPoint #1 mentioned. Remove gloves, wash hands, then take your lab coat off if you have it on, and then wash your hands again. Or go and do your restroom break before you start putting gloves on, so that you aren't wasting the PPE. If you're on the job, you know, consider, do you have enough time between clients or other procedures that you have to do the necessary lab tasks? Maybe surgery is going to start in 10 minutes and you don't want to be rushed. So think ahead. Always be thinking ahead. Put on your critical thinking cap and do some really good decisions as you prepare yourself and your lab space. And then again, remove excess items. Know the steps that you plan to do. Have a sheet. If you're learning how to do the gram stain, write out those steps. That will be part of your homework here in your lab work assignments in this week. We'll be actually probably writing out the steps for the gram stain. You may want to put that down on a 3x5 card just to remember also how to do that. I will be illustrating inoculation techniques, of course, both in the hands-on time, but also I'm planning to do a brief video about each of these. But just to read this through and to read the pages 259 to 261, in a sense, when we say keep the plates closed unless you're working with a specimen, so if you have a source specimen on a plate, you don't want to just open up the top and let the microbes in the air land on that media, okay? What we talk about, the media half of the plate always kept up. So you have two parts. One has media in it. One is kind of the cover section. And actually, it is the media will always be facing up. This helps reduce moisture from the non-media lid. So if you put it into the incubator with the media on the bottom and moisture drips, it will drip down on that media, and you really don't want that. If you're using a tube, we'll show you a flaming technique before you actually put a inoculation loop into that tube, and then avoid touching any parts of the inside caps or placing on the surface. So dexterity is necessary. And again, this slide will be very critical in the hands-on time. With the inoculating loop, if it is metal, you want to flame it from the body of the wire and work out to the loop end. You want to flame that reused item so that no microbes are on it when you go to get your sample. In labs and in our lab now, we have plastic loops, so you don't have to flame. One, they would first they would melt, but also they are disposable, so they're a one-time use. But with that said, you don't want to put your inoculation loop on your newspaper, at your lab set, touching it to anything other than the media that you want to inoculate or get your specimen from. Inoculate a small sample of liquid on a swab. Go to the edge of the plate. We'll show you that technique. And again, we like to use rayon swabs, not cotton swabs. There's what's called a lawn technique. We use that with a Kirby-Bauer test that we use. You'll be introduced to that. So lawn technique for inoculation, 4-quadrant inoculation, and slant inoculation. Please reference your textbook on the pictures, and I'm hoping to be able to put a video together to illustrate those. Consideration for tips about the identification of organisms. Again, incubator generally at 37 degrees centigrade or Celsius. If you have fish or skin samples, you may want to lower that. Considering that generation time, remember the growth phases that there are. Consider that generation time determines your length of time might be required in the incubator. So if after 24 hours there doesn't appear to be growth, you probably want to keep that plate still longer and see what happens. Again, invert your culture plates, meaning the media is on the top. You might have that candle jar that was explained in the first PowerPoint also for organisms that like carbon dioxide. It is not an anaerobic condition, but it does increase your carbon dioxide, and the textbook talks about that. A dichotomous key. Okay, so dichotomous key is illustrated in the textbook, and I'm looking for the page number. It's on page 257, is an illustration of a dichotomous key. It is just basically a flow chart that helps you differentiate bacteria. There is a textbook, it's called Berkey's Guide to Bacteria, or Berkey's Guide. It will probably be one of your reference areas for microbiology in this module. And the very first question, this is basically a dichotomous key, is a series of yes and no questions. And the very first one is, does your organism, is it gram positive or gram negative? And you say, it's gram positive, that's my yes. And then you might say, is it a rod or a cocci? It is a cocci, that's my yes. Is it single? Is it in clusters? That would be your next key. So it is a dichotomous key, helps you work through yes and no kind of questions and helps you flow down to the best choice of a probable diagnosis. Unless you're really working at a diagnostic lab, you will always have presumed or probable diagnoses, unless you have a known organism. But you want to consider also the size, the shape and arrangement of your organisms, your chemical reactivities. Those would be some of the tests that you'll be introduced to. Also, how does the colony appear? What is the pigment color? How's the density of that? Is it very sparse? Is it risen in the middle? Does it look like a little mountain forming? Does it have craters? Does it kind of swarm like honey spilled on a table? Would it kind of swarm around the edges? Okay. Is there an odor? We'll show it a technique that's called wafting to see if there's an odor. Is there hemolysis pattern present? Those are all different kind of questions to ask to help you with the dichotomous key. Again, Appendix B is sort of a resource a little bit about that also, and you'll be hearing about parts of this in next week's presentations too. So antibiotic sensitivity, okay? So we're starting to go into some of the tests that you'll be doing, again, doing these hands-on. So remember this knowledge, bring it to this fall term when we have the hands-on. Okay, so antibiotic sensitivity testing. This is going to determine susceptibility or resistance to general antimicrobial drugs. And this helps guide the veterinarian for the treatment to that specific pet. It is actually also called an agar diffusion test. Impregnated paper discs, and we call it, it is utilizing the Kirby-Bauer method. A couple other items to understand: the abbreviation MIC, M-I-C, minimum inhibitory concentration of that antimicrobial to inhibit the growth of the bacteria. There are, we'll come back to this in a second, so the paper discs that have the antibiotic impregnated in it, you can purchase those as various concentrations of that antibiotic. Now, quite often, a general practice lab, general practice veterinary office will probably just have a couple choices of these discs. But if you were working at veterinary diagnostic services, diagnostic laboratory, they may have a variety of concentrations, a variety of antibiotics to see at what level of the drug would it actually inhibit the growth. And then you actually measure. You measure around it in millimeters and you compare that to a chart. So read about the steps in your textbook for the antibiotic testing. More about this Kirby-Bauer disc tests. You certainly want to consider, what is your patient? Is it a rabbit? And if so, what antibiotics could the doctor even use? So ask your veterinarian. Don't make the decision by yourself, but ask him, what antibiotics could we use? Or a dog or a cat. Maybe it's a mean cat, and they say, you know, the only two choices are going to be this. So why waste the products of something you cannot even utilize for your patient? Again, this is really for general practice. Shoot.